Hey guys, hi, welcome to Unacademy. This channel is Unacademy Future Doctors, and I'm your educator for biochemistry, Dr. Shivangi Shukla. I welcome all of you to this session, that is MCQ based discussion session. Let me just check if the live stream has started or not. Just give me a minute to check if the live stream is running proper. Am I visible and audible to everyone? Do let me know. Alright, so let us begin this session. I welcome all of you to this session today. Uh, so this is another session in the League of MCQ based discussions. This is quite an enjoyable session with everyone, or I get the feedback that this is the MCQ based sessions are such that all the students they give me the feedback that they enjoy it, because what is it that the maximum people here, the maximum audience are those who have just taken. The maximum audience is the one who has just completed its first professional MBBS examination, and those who are going to take the NEET PG examination. Okay, so they are the ones who want MCQ based discussion. The first year people who just entered the second prof, they want to be in touch with the first year syllabus, so they can the best way that they can do it is through MCQ based discussion. And for those who are going to take their NEET PG examination, the the more you cannot highlight the importance of practicing MCQs enough for them. Okay. Anyway, so till the others join in, I'll just quickly brief you about the different types of subscriptions for NEET PG that are available on the Unacademy app. Now, both Iconic as well as Plus subscriptions are available for NEET PG. Both of them will give you access to video lectures from top educators across the country. These video lectures can be accessed even in the recorded format after the live class, and they can be accessed while on the go on any device of your choice at any time, n number of times. And not just these video lectures, but also the printed PDF notes and other notes, other textbooks, and also question banks containing more than 25,000 questions, also using state-of-the-art technologies. So these are the other things that will be provided to you. Iconic subscription. The Iconic subscription will also give you access to the resources from the Dream Pack in Prep Ladder. Okay, from Prep Ladder. So therefore, it is called Best from Two of the Best. Okay, so you can check out any of these two subscriptions. In addition, I have one important announcement that Unacademy has come up with a revision batch for those of you who are going to take this year's May 2022 examination for NEET PG. Okay, that is on the 21st of May. So between the 16th of March and the 16th of May, there will be a lot of revision classes from more than 40 educators, and grant tests, 8 grant tests and 19 subject-wise tests. Okay, so you will get access to these. So please do enroll in this batch. And for any subscription that you wish to take, do not forget to put in the educator code, that is DRSHUKLA. Now this code is going to fetch you an additional discount of 10%. Okay, what is this code? It is DRSHUKLA, Dr. Shukla. It will fetch you a discount of 10% on any of the subscriptions. Do not forget this code. Alright. Just 3 days are left in the month of March. Let us utilize it to the maximum so that we practice a lot of MCQs, because then April and then May. Okay, the third week of May is the exam. So let us utilize all the days to their maximum. Okay. Now we completed till this question, one carbon transfer. Now this is the question that we have to start with. Okay, what is unique about the enzyme phosphoenol pyruvate carboxykinase? Okay, now before I start, I'd like to tell you the rules of this quiz. You have to answer in the comment section. I'll give you 2 minutes after every question to answer. You have to answer in the comment section, and then after the 2 minutes are over, we'll discuss the answer, the correct answer, as well as the other options, and we'll have a word about the topic. Okay, so that we can discuss and we revise as much as diversified. Our discussion and our revision is as diversified as it is possible in this short duration. Okay. All right. So let us start with the first question for today. All right. All the best, everyone. Come on, buckle up. Buck up. Okay. What is unique about the enzyme phosphoenol pyruvate carboxykinase? What is unique about the enzyme phosphoenol pyruvate carboxykinase? A. It does not require ATP. B. Does not require, sorry, A is it does not require energy. B. It does not require GTP. C. It requires ATP. Or D. It requires GTP. Okay, which of the following is the correct answer? So your time to answer starts now. Come on. Come on, come on. Look at this question carefully. Come on, guys. Come on. Answer fast. Come on. Last 1 minute left. Okay, so the correct answer here is that it requires GTP. What is GTP? It is guanylyl triphosphate, right? Guanine triphosphate. Now, normally, in any reaction that involves kinases, what happens? What is the enzyme that we use? Usually, what is the energy donor, the energy currency? It is ATP, right? Like in hexokinase. Hexokinase is what? Hexokinase enzyme or glucokinase enzyme. Now, what are these enzymes? What do they do? Hexokinase and glucokinase, both are the same. Glucokinase is present in the liver and hexokinase is present in the other cells. Now, what does this do? It converts glucose it adds phosphate to the glucose. So, it adds phosphate at the 6th carbon position in glucose. Okay, so glucose to glucose 6 phosphate is done by hexokinase or glucokinase. Now, these are kinases. Kinases are transferases. They transfer phosphate group from one molecule to the other, or in substrate level phosphorylation, they transfer phosphate group from the substrate level. Okay, they involve the formation of ATP. Now, here what will happen? ATP will either be used or produced. Okay, in this step, ATP is used because phosphate is getting added. Okay, now when phosphate will be removed, ATP will be produced. Now, anyway, but this enzyme, phosphoenol pyruvate carboxykinase enzyme, what is this enzyme and where is it occurring? This enzyme is a key enzyme in gluconeogenesis. Okay, now what does this do? Now you remember phosphoenol pyruvate changes to pyruvate through pyruvate kinase enzyme. Now if you want to reverse this step, this is an irreversible step of glycolysis. If you want to reverse this step, what do? You want to reverse the step, you'll think that you will change the enzyme and that particular enzyme will directly convert pyruvate to phosphoenol pyruvate, but it is not that direct or that easy. So what happens is, in gluconeogenesis, pyruvate will convert to phosphoenol pyruvate, but via an intermediate, and that intermediate is what? It is oxaloacetate. Oxaloacetate, yeah, it is the same one which is in the mitochondria in the Krebs cycle or the TCA cycle or the citric acid cycle. Now let us look at the enzymes and their intricacies. This enzyme is what? It is pyruvate carboxylase enzyme. And what is so special about it? It requires the cofactor biotin. Very, very important. Okay, so pyruvate carboxylase enzyme requires the cofactor biotin. Okay, now this oxaloacetate 2-phosphoenol pyruvate, this enzyme is phosphoenol pyruvate carboxykinase. Understood? And this requires GTP, guys. This requires GTP. Okay, and where is this GTP coming from? It is coming from the same place this oxaloacetate is coming from. Yes. Where is it coming from? From the Krebs cycle. You remember this step of the Krebs cycle? That is the substrate level phosphorylation which I was telling you about. Succinyl CoA converting to succinate. This is the substrate level formation, phosphorylation step. The only step which involves the production of ATP. Now, this ATP is produced in all the cells of the body that have Krebs cycle undergoing in the mitochondria, going over in the mitochondria. But inside the liver cells and the kidney cells where gluconeogenesis is occurring, instead of this ATP, GTP is produced, and this GTP is required here. It is utilized here. Understood how different reactions are interlinked? Isn't it so interesting? Isn't it intriguing? Once you get it, it is like a voila, it is like a eureka moment, isn't it? Once you get to know, okay, this is what is happening. It is so intriguing and interesting, isn't it? I almost go, Eureka! I got it. Or voila! Is this it? This is how my reaction is once I get to see some kind of a these kinds of information. Okay. So understood or not? All right. Should I continue with the next question? The next question is, which of the following is not true regarding syn and anti-conformers of nucleosides? Okay. Which of the following is not true regarding syn and anti-conformers of nucleosides? Have you heard of syn and anti-conformers? Okay, I hope you have, because then only you'll be able to answer this. A, they exist about the glycosidic bond. B, they are freely interconvertible. C, they involve breakage of the glycosidic bonds. Or D, all are true. Which of the following is not true? This is what it is asking. Okay. Alright. So the time to answer starts now. Come on, guys. Answer this. Okay. Come on, come on. Last 1 minute left for you to answer this one. Come on. Last 30 seconds left now. Come on, guys. Do answer. Do try and answer this. Alright, now the correct answer is what? It is not true. It is asking. I hope you've paid attention to it. They are freely interconvertible. This is the wrong or the false statement. Why is it so? What are syn and anti-conformers of nucleosides? If you had paid attention to it, you would have realized what these are. What are nucleosides? Nucleoside, what did I tell you the mnemonic for nucleoside? Sugar on the side, please. So what are these? Nitrogenous bases plus sugar, or ribose or deoxyribose sugar. Nucleoside, sugar on the side, nucleotide, phosphate tied to it. Okay. So nucleosides are nitrogenous bases plus sugars, nucleotides are nitrogenous bases plus sugars plus phosphate, or nucleoside plus phosphate tied. Okay. So this nitrogenous base plus sugar is called nucleoside. And how is it arranged? Now this is the nitrogenous base and it has the sugar like this. If it is like this, it will be syn. If it is opposite like this, it will be anti. Now this is which bond? This is the beta N glycosidic bond. What is this? How do you say? N from the nitrogenous base. Beta, that is the beta carbon of the sugar. So beta N glycosidic bond. Okay. Now this bond has to be first broken and then the sugar has to be turned about its axis and then another bond will be formed to produce it as an anti-compound, anti-conformer. Okay. So they will exist about the glycosidic bond. Which type of glycosidic bond? Beta N glycosidic bond. Very true. Very good. They involve breakage of the glycosidic bonds. Yes. The interconversion of syn and anti-conformers requires breakage of the beta and glycosidic bond. They are not freely interconvertible. Why? Because if you see this one, if B is true, C cannot be true. If C is true, B cannot be true. Okay? So the correct answer is B. It is not true. Okay? Next question. A child presents with mousy odor in the urine and delayed development of milestones. There is reduced pigmentation of the skin and the hair. Upon tyrosine supplementation, the serum prolactin levels were measured and found to be high. Which of the following is deficient? Okay. A. Tyrosine, B. Tetrahydrobiopterin, C. Phenylalanine hydroxylase, or D. Prolactin. Got it? Okay. Understood? Now the time to answer starts now. Choose the most appropriate answer. Come on, the time has started for you to answer. Okay, so the time is up for you to answer. Now, this one requires a lot of understanding. I hope you understand this enough. The correct answer here is, what is the correct answer? Tetrahydrobiopterin. And why is it so? Okay, let us see. I have already discussed this thing quite a lot of times with you. Phenylalanine converts to tyrosine using which enzyme? Phenylalanine hydroxylase in the presence of tetrahydrobiopterin. Okay. Now, if phenylalanine hydroxylase enzyme is deficient, what is it called? Deficiency of phenylalanine hydroxylase is called classical phenylketonuria. And the deficiency of tetrahydrobiopterin is called variant phenylketonuria. This is obviously milder in symptoms, but the same symptoms are there, similar symptoms. Okay. Now what happens is, if either of these two is absent, what will happen? Phenylalanine will not convert to tyrosine. Tyrosine will be deficient, and phenylalanine will be in excess. Okay. Now, what are the symptoms of excess of phenylalanine? Phenylalanine is a large neutral amino acid transporter between the blood and the brain, that is through the blood-brain barrier. Okay. Sorry, phenylalanine is a large neutral amino acid. It gets transferred between the blood and the brain through the large neutral amino acid transporter that is present in the blood-brain barrier. Now, there are a lot of other large neutral amino acids also that have to pass through the transporter, and they are required to produce important neurotransmitters. For example, tryptophan is needed to produce serotonin, melatonin. Okay. Now, this phenylalanine, when it is in excess, it is going to crowd around the large neutral amino acid transporter, and it is going to prevent the entry of the other large neutral amino acids. That leads to deficiency in important neurotransmitter synthesis, which leads to neurological symptoms like cognitive delay, delayed milestones, then seizures, okay, ADHD symptoms, that is attention deficit hyperactivity disorder symptoms, okay. And when there is phenylketonuria in the urine, it will lead to mousy odor, okay. And why is there phenylketone in the urine? Because phenylalanine is an amino acid. When it is in excess in the blood, it will be transaminated to an alpha keto acid. What is conversion of the reversible conversion of alpha amino acid to alpha keto acid? What is this called? It is called, it is called transamination. Okay. The reversible conversion of alpha amino acid to alpha keto acid is called transamination. Now, this transamination reaction is going to convert phenylalanine to phenylketone. And what type of phenylketone? Now, alanine will transaminate to pyruvate. So, phenylalanine will transaminate to phenylpyruvate. Okay. So, the most abundant or the most prominent phenylketone in phenylketonuria is phenylpyruvate. Okay. There are other phenylketones as well. Understood? Okay. Now, the deficiency of tyrosine is going to lead to defects in skin pigmentation. Why? Because of defective or inefficient Melanin synthesis. The skin and hair will reduce there will be reduced pigmentation in the skin and the hair. Now comes the second part of the question. This tyrosine, when it is formed, this tyrosine converts to L-DOPA to tyrosine hydroxylase, and this tyrosine hydroxylase, just like phenylalanine hydroxylase, also requires tetrahydrobiopterin as the cofactor. This L-DOPA will convert to dopamine, and this dopamine will inhibit the synthesis of prolactin. So if dopamine is present in significant amounts in the body, it will reduce the serum prolactin concentration or serum prolactin level. But here what is it saying? The serum prolactin levels are found to be high. Now this tyrosine is not getting produced here. Okay, but if you give this person tyrosine and if you measure the prolactin levels, okay, then what will happen? If you give him tyrosine, then tyrosine hydroxylase will act and in the presence of tetrahydrobiopterin to produce L-DOPA, dopamine, and this dopamine will inhibit prolactin, therefore serum prolactin levels will be low. But this is the case only when tetrahydrobiopterin is normal. Tetrahydrobiopterin is present in normal quantities. That is, the phenylketonuria is due to deficiency of phenylalanine hydroxylase. Now suppose this phenylketonuria is due to deficiency of tetrahydrobiopterin, then here also this reaction will also not proceed because tetrahydrobiopterin is needed here, which is deficient. So if this reaction will not proceed, then what will happen is, that dopamine will not be synthesized. And that means the inhibition on prolactin is relieved and prolactin levels will be high, which is the case in this question. The serum prolactin levels were measured and found to be high. Therefore, dopamine is not produced. L-DOPA is not produced. That means there is deficiency of tetrahydrobiopterin, the common factor in both these cases. Understood? So this is how you differentiate between the classical and the variant forms of phenylketonuria. Okay, so I think we'll stop here now. We'll take a break for 5 minutes and then we'll join in the next session. Okay, take a break for 5 minutes, have some water, relax your eyes, give your eyes some rest, have some snacks, and then meet me after 5 minutes in the next session. Okay, the next session will also be an MCQ based session, and also tonight at 10:45 we're going to have another MCQ based session, that is MBBS, on the Unacademy app through a special class. Okay everyone, got it? If you haven't subscribed to this channel, then do subscribe to this channel for regular updates and notifications of my classes well in advance. And also you can follow me on the Unacademy app. Go to the Unacademy app if you have it in your phone. If you don't, then go to the Play Store and download the Unacademy app, and then go to the NEET PG section and there look for Shivangi Shukla, and then you can follow me there for regular updates of all my classes. Okay, you'll be notified about my classes. Okay, so I think we'll stop now. Thank you. Bye bye. Take care, guys. See you in 5 minutes in the next session. Okay, bye bye. Take care.